Thank
Over
you,
to you.
Mala, and those who participated in this session. Good morning, good afternoon, good evening. Welcome to 1686th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you and welcome back. Today we have with us Dr. DILIP JANI, LCEH, D acupuncture, CCH, CCMP, consultant homeopathist, Shivaji Nagar, opposite Konkan Bank, Govandi, Mumbai, Maharashtra, with more than 30 years of clinical experience. The topic is homeopathy in surgical cases. On behalf of IFPH, welcome, doctors. You can have the platform for the next 45 minutes. So please proceed, sir. Dr. Dilip, please. Okay, yes, welcome.
Yeah, thank you, sir. Yeah, thank you very much. So good evening, all the respected doctors. My sincere thanks to Sani sir, Dr. Ganesh sir for inviting me for this prestigious platform. And I consider as my honor to share my experience on this prestigious platform. I am Dr. DILIP JANI. I am practicing in Mumbai since last 25 years, more than 25 years. I passed my LCEH graduation from Mumbai CMPH college. I started my general practice and I also using homeopathic medicine. But I was not satisfied with my result, especially with the single dose. So there in 2011 and 12, one of my friend introduced me to Dr. Segal sir's system of mind method. After that, I learned about the mind method and started practicing on mind method and got some very good, amazing results in that with the single dose. So I since then, last 10 to 12 years, I am practicing especially on mind method, though I believe mainly in mind method, but I am open to all the other methods also. And sometimes I practice on the other methods also. So shall I share my screen?
Yes, yes, surely.
Yeah. Is it visible?
Yes, yes. Okay, thank you.
Yeah. How to enlarge? Or is it okay?
Okay, okay. Please proceed.
Okay. Thank you, sir. So before starting the session, we should gratitude our masters, Dr. Hanuman sir, who gave us this divine science. Master Dr. M.L. Segal sir, my mentor Dr. Mahesh Chandra sir from Delhi, then Dr. Prem Sharma sir also from Delhi, then Dr. Sanjay Segal sir from Delhi. So today my topic is homeopathy in surgical cases. See, when we talk about these surgical cases, we usually know that patient goes for the operation. But there are some conditions where we can also give the homeopathic medicine within the principles of following the principles of homeopathy. But by no now the surgical procedures are so advanced that by no means we can say that homeopathy can treat each and every surgical procedure. Now today's era, we have to be more practical. But according to my clinical experience, there are mainly the three types of the surgical cases we see in our practice. One is the pure surgical emergency cases, where immediate surgery is required to save the life of the patient. Here, if we give the example, then there is rupture ectopic pregnancy, rupture of the appendix, where we cannot wait for the to give any medicine for the patient. Imminent surgery is required. Otherwise, the life of the patient is at threat. Second is where the surgery is planned. And the third one is the cases where the surgical procedure is risky with various reasons. For example, in elderly patient or the patient with the immunocompromised status. Here, the surgical procedure itself may be risky for the patient. Now, in such cases, if there is no emergency, no imminent threat to the life of the patient, we can give homeopathic medicines for such cases and wait for some time. If we get a favorable response, we can continue it, or we can take the patient for the planned surgery. Or we should remember that it is not the homeopathy or surgery. It is the patient who is important. Our life is to save, our main aim is to save the patient's life. Now, we have to follow this, we have to treat this patient, surgical patient, within our principles of homeopathy, following the principles of homeopathy. For that, if we read the aphorism 2, everybody knows that the highest ideal of cure is rapid, gentle, and permanent restoration of the health, or to removal and annihilation of the disease in its whole extent in the shortest, most reliable, and the most harmless way on easily comprehensible principle. So our cure in such cases also should be rapid and gentle. Patient should not get much disturbed and he should get the permanent restoration of the health. Now, if we see the aphorism 3, which says if the physician clearly perceives what is to be cured in the diseases, that is to say, in every individual case of the disease, means knowledge of the disease indication. If he clearly perceives what is curative in the medicines, that is to say, in each individual medicine, knowledge of the medicinal power. And if he knows how to adapt according to clearly defined principles, what is curative in the medicines to what he has discovered to be undoubtedly morbid in the patient, so that the recovery must ensue to adapt it, as well as in the respect to the suitability of the medicine most appropriate according to its mode of action to the case before him. That is the choice of the remedy, the medicine indicated, as also in respect to the exact mode of preparation and quantity of it required, means the proper dose and the proper period of repeating the dose. If finally he knows the obstacles to recovery in each case and is aware how to remove them so that the restoration may be permanent, then he understands how to treat it judiciously and rationally, and he is a true practitioner of the healing art. So in this aphorism, our master says that the knowledge of the disease is important, knowledge of the medicinal power is important, then how to apply it, how to apply this knowledge in the patient, then which is the indicated remedy, how to select the remedy, how to, what dose to give, and what is the repetition to give. All these things are important. And at the last, only giving the medicine is not important. If the recovery does not ensure, then we have to see whether there is any obstacle which is coming in the recovery of the patient. Then we should try to remove that obstacle also, so that the patient gets permanent cure. So we proceed with the case. Now we see how to apply these principles in these surgical cases. So this is the first case of inguinal hernia. This was a 93-year-old male patient. This patient had come to me during the time of the COVID, where the doctors were not available. No physician, no surgeon, no radiologist were available. This patient is father of one of my general practitioner friend. He's a 93-year-old male. He was retired from BSNL, now staying with the elder son in Mumbai. He was staying with his son in Mumbai. He had a benign prostatic hypertrophy along with the left inguinal hernia since 5 to 6 years. What was the present complaint? Now there was a gradually increasing pain in the left inguinal hernia since 1 week. Along with that, hernia was not reducible. Previously, it was reducing on lying down, but now it was not reducing on the lying down. During this COVID time, I had taken this case on the phone. So I told them to send this picture of the hernia. So that time, his son sent me this picture. So here we can see the bulge of the hernia, and the picture is taken in the lying down position. So we can see even in the lying down position, this hernia sac is not means going inside the abdominal cavity. So it is not reducible. So such cases, we are in a dilemma whether we should treat such cases or not. So this time the knowledge of the disease, our clinical knowledge is very important. As we saw in aphorism 3, just now what I read, if the physician clearly perceives what is to be cured in the disease, that is to say in every individual case of the disease, means knowledge of the disease is very important. So here we should know what is hernia, which type of the hernia is there, and exactly exactly where we are standing, whether to treat this patient or we are playing with the life of the patient. We should refer the patient to any surgeon. So what is hernia? Hernia, when the part of an organ bulges through the wall of the tissue in the body. So this is hernia. Here we can see the small intestinal bowel. Then we can see the abdominal wall, subcutaneous tissue, and the skin. So this hernia sac bulges through the weak abdominal cavity, weak abdominal muscles, and it bulges out in the subcutaneous tissues. Now we see what are the types of the hernia and which type we are dealing with. So we see the first is a reducible hernia. A hernia is said to be reducible when the contents of the sac can be returned to the abdominal cavity. And there is impulse on cuffing, that is a positive cuff reflex. So when we examine the patient of hernia, if the patient is standing or the patient is lying down, that time if we put our finger near the internal inguinal ring and ask the patient to cuff or to increase the abdominal pressure, then we can see, means we can feel the reflex on the near the internal inguinal ring. Or in another sense, if the patient is standing, that time the hernial bulge comes out. Or if there is any increase in the abdominal pressure, the hernial sac comes out. And when the patient is lying down, that time the sac goes inside the cavity, abdominal cavity. That is a reducible hernia. Second thing is the irreducible hernia. In this, the contents cannot be returned to the abdomen. There is neither the inflammation of the contents nor the interference with the blood supply. So only thing is that the hernia comes out, but it does not go back inside the abdominal cavity. But there is no inflammation or there is no interference with the blood supply. This is irreducible hernia. If you go further, then there is obstructed hernia. Obstruction means irreducibility, means hernia cannot be reduced, and plus occlusion of the bowel. The bowel gets occluded either partly or fully. Here the lumen of the bowel is occluded without interference with the blood supply. So the lumen is occluded, but blood supply is still not compromised. And the last one is the strangulated hernia. So strangulated hernia is characterized by irreducibility. It is a non-reducible hernia. Obstruction is there, obstruction to the bowel wall, and the arrest of the circulation. Even the circulation is compromised. Here the contents are so constricted as to interfere with the blood supply. So hernia becomes irreducible, tense, and tender. Now, if we see this picture, we can see the this intestine going through the abdominal wall, weak abdominal wall, and this wherever the hernia ring is there, it gets constricted or it gets contracted, and because of that, the hernial sac cannot go inside the abdominal cavity, and the this hernia, whatever bowel wall is there, this bowel cavity is there, that is also obstructed, and the blood supply is also compromised. So this is known as the strangulated hernia. Now, how do we decide whether the patient, our patient belongs to which category, whether it is a reducible, irreducible, obstructed hernia, or it is a strangulated hernia? So here I ask the patient whether, during the case taking, I asked the patient whether you can pass the stool or not. So patient told me today morning I passed the stool, and there is he could pass the flatus also. So here with my little knowledge, clinical knowledge, I came to the conclusion that it was an obstructed hernia, but it was not completely obstructed, and the pain was not much. So this circulation was also not compromised. So I came to my clinical impression that it was a partially obstructed left inguinal hernia. So whatever these four types we saw, it was the third type. But this can lead, anytime it can lead to the strangulation also. And if we don't treat the patient at this stage also, that strangulation can lead to gangrene, and further it can lead to septicemia. So if patient comes at this stage or gangrenous stage or stage of septicemia, then we should be cautious not to treat the patient and better refer this patient to the surgeon. So what I came to know means this my impression that it was a partially obstructed left inguinal hernia. So here I thought to give a chance to the patient for and wait for 1 or 2 days and see the result. If the result is not favorable, I told my friend that we will call a surgeon and take his opinion. Now here we should also know what are the red flags in this treating such patients. What are the signs of emergency where we should not handle and we should refer the patient. The first is the constipation. If patient is totally constipated, there is a severe constipation, there is no passage of stool or gas, there is a vomiting, and if there is a distension of abdomen, these all signs indicate the hernia is completely obstructed. So anytime patient can go into strangulation, patient can go into the gangrene. So better not to dwell with such patient. Now that was the first part, that is the knowledge of the disease. Now we come to the homeopathic part. If the physician clearly perceives what is curative in the medicine, that is to say in each individual medicine. So we should now know the knowledge of the medicine, means which medicine to apply. Here, Dr. Kent, sir, one of our stalwarts, he mentions in his philosophy book, the first chapter, the sick. What is meant by the sick? It is a man that is sick and to be restored to health, not his body, not the tissues. So we should know what is hernia. We should treat the hernia, but at the same time, considering the principles of homeopathy, we should treat the patient and not the tissues, whatever may be the diagnosis. So this, it was taken by the phone call, and the patient, this full conversation was in Hindi, but I am translating it to the English. Patient says, "Namaste, Doctor Saab, kaise aap?" In a very mild tone. "Hi, doctor, how are you?" Then I asked, "क्या तकलीफ है आपको? What is the problem with you?" Patient told, "ये hernia अभी कम नहीं हो रहा है, उसमें दर्द होता है." That means hernia is not reducing, and I am getting little pain in that. And his tone was very mild tone. Then I told, "What do you think about it? आपको क्या लगता है इसके बारे में? What do you feel about it?" Patient told, "लेटरिन भी साफ नहीं आती." Means not getting the proper motion. Whatever motion he got in the morning, he was not satisfied with that. Then patient was staying with his elder son. So I asked elder son about his nature. How is his nature? He told बहुत माइल्ड नेचर है, किसी से लड़ाई नहीं, झगड़ा नहीं, कुछ तकलीफ है तो भी हमें ज्यादा बोलते नहीं, रात में बाथरूम जाना है तो भी किसी को उठाते नहीं. He is of very mild nature, never fights with anyone. Even if he is getting some problem, he does not tell us about it. If he wants to go to the washroom all night, he never asks for the help, as he thinks that our sleep will get disturbed. ऐसा कभी गुस्सा नहीं करते, लेकिन अगर गुस्सा करे तो किसी की भी सुनते नहीं. As such, he does not listen, he does not get angry, but once if he get angry, then he would not listen to anyone. So this was the case taking, which included 3 parts. One is the narration from the patient, another by the patient's relative, and the third one by the observation by the physician. So how we go in this case, according to how we analyze the patient, how to take the rubrics. So first patient told, "Hi doctor, how are you? Namaste Dr. Saab." That was, here we can take the rubric reverence for those around him. Reverence means the patient is showing the deep respect of all the people surrounding him. Then his son told he is of very mild nature, never fights with anyone, no quarrels with anyone. Here we can take the rubric mildness. Mildness means he is not aggressive, not quarreling with anybody else. So that is a mildness. Here he wants to go to the washroom at night, never asks for the help because he thinks that the sleep of the other people will get disturbed. So here we can take the rubric anxiety for others and cares, worries full of others about. And the last, whatever patient told, means his son told, as such he does not get angry, but if he gets anger, then would not listen to anyone. This is the rubric delirium angry. If we club all these rubric, we get the only one medicine, and that is cocculus. But when I saw the cocculus in the particular chapter of our repertory, in the abdomen, so in the cocculus, all the other rubrics were also covering this cocculus. In the abdomen section, hernia abdominal inguinal. Hernia abdominal inguinal, that is left. This patient was also suffering from the left. Only two medicine, cocculus and thuja. Then hernia abdominal inguinal strangulated. Though I thought that this patient is not in the strangulated hernia, but even if strangulated hernia is there, we can definitely give a trial with this medicine and wait for some time to see the response. So here, considering all these rubrics, reverence, mildness, anxiety for others, scares full of, delirium angry, then all these particular rubrics of abdomen, hernia inguinal left, and hernia inguinal strangulated. This cocculus clearly came out to be the prominent remedy. So I gave cocculus 30 in the water doses every 3 hourly. And I told him to report on the next day. By the next day morning, when his phone call came, he told that he could pass the motion today morning also. The pain was also reduced. Then over the period of 3 to 4 days, the hernial bulge started reducing. And after that, the hernia, which was irreducible, became reducible and went inside. After that, patient was all right for 2 years. For the 2 years, he did not suffer from such obstruction or any other problem. So we could avoid the surgery in this case. And after 2 years, he expired because of the old age. So shall I take the question now or at the end of the session, sir?
At the end of the session, sir.
Okay. Okay. Thanks. So this was the first case of obstructed inguinal hernia. Now the second case. This case is of preauricular sinus, chronic preauricular sinus. This 14-year-old boy came to me for the right preauricular sinus since 5 years. He was brought to me by his uncle. The patient was staying in the UP with his parents and siblings. He came for the recurrent attacks of the swelling with the pain in the right preauricular area. Here he had a sinus, the right, just in front of the right ear. It was remaining for 1 week or 10 days, followed by the discharge of the pus. There was a swelling, then followed by the discharge of the pus. After that, he was relieved. Then again, it was remaining for some time. Then it came back. This was going on since 5 years. Every time, whenever he used to go to the doctor, he used to receive antibiotics, painkillers, other medicines. After some time, he got used to it. And whenever there was pain and swelling, he started taking this medicine on his own. He showed to some surgeons in the UP. They advised him to get operated. Then once his uncle, who is staying in Mumbai, he visited this village. That time he saw this boy and told him to come to the Mumbai for the treatment. So he was brought to Mumbai and he was brought to me by his uncle. Here also his uncle has taken advice from some ENT surgeons who told him to get operated, but there was no guarantee that the sinus will not recur. Nobody gave him guarantee that it will not recur. So his uncle thought that better give a trial with the homeopathy and see. And if it doesn't get better, then we'll get operated. So during the case taking, I asked him, what are you doing? What studying are you doing? So he told me that I'm in the 8th standard in CBSE board. Then I asked him, how are you in the studies? He told, I'm average. Okay, not bad, not that good. Then I asked him, now you have come to Mumbai. Then what about your studies? How do you manage your study? How will you manage your study? Here, my purpose was asking this question that I thought that he has come for the treatment of the sinus and he knows that it is going on since 5 years. So it may take a long time for the treatment. So I thought since he was in the CBSE board, he might shift to the Mumbai for the study and he might take the admission in some CBSE school in Mumbai. Then I asked him, so patient told me that he has come only for the purpose of the treatment. And he told, I will continue to study at my native place only and not in Mumbai. Then I asked him, what are you worried about most? So here he told me, I am more worried about my studies. My studies should not get disturbed. Daily, I ring up my friends and ask them about daily lessons, what is going on in the school. They send me their notes on WhatsApp. I write it down. So that's how he was studying daily, taking these notes from his friends and studying here with alone. Then I asked him, how do you manage during the time of the pain and swelling? When the pain and swelling is there, how do you manage it? What do you do? So patient answered, nowadays, whenever I get it, I start taking antibiotics and painkillers on my own. I take it for a few days. And when pain is more, I want to lie down for some time. Sometimes he lies down. When the pain and discharge stops, I stop the medicine. I hardly trouble my parents for these complaints. Now it has become like a habit for me. Now I have become used to it. Then further he told me that when I go to school, I don't feel the pain. And my aim is to give the NDA exam. And for that, myself and my friends, we are studying some relevant books also. So these are the pictures of this patient. I have labeled this picture from left to right and upper downward. This was the first picture when the patient came to me. Then second picture is of the follow-up. Third picture is of the further follow-up. And the fourth picture is the very recent picture where we can clearly see that this sinus is completely healed. So how to go about this case? Here this boy was ambitious. He wanted to give NDA exam and also he was working for it. He was reading the relevant books also for that. So here I took the rubric ambition increased and it was a competitive exam. So ambition increased competitive. Ambition means there is a strong desire to be successful. If the patient says that I have a desire to become a doctor, I have a desire to become an engineer, but he is not working for it, then we should not consider this rubric, ambition increase. It is to be taken mainly when the patient has a strong desire and he is working for it. If he doesn't work, then it is difficult to take this rubric. Then after some time, he got used to it. And whenever there was a pain and swelling, he started taking medicine on his own. That is what he told me. This is the objective reasonable. And when the pain is more, I want to lie down for some time. This is bad desire to remain. Then he says, I hardly trouble my parents for my complaints. Now it has become like a habit to me. I am used to it now. So this shows this patient is of very mild nature. Mild means the quality of not being violent, not become severe or extreme. When the patient says, I am more worried about my studies should not be disturbed. Daily, I ring up my friends and ask them about daily lessons in the school. They send me their notes on the WhatsApp. I write it down, and that's how he is studying. So he's more worried about what is going on in the school and more worried about his studies. Here, there is a very beautiful rubric, anxiety children in school children about their lessons. This is a direct rubric from the complete repertory. And when he's telling that when I go to school, I don't feel the pain. That is an occupation ameliorate. Means when the patient is occupied, when the patient is busy, that time he does not feel that much of the pain. That is occupation ameliorate. And from the clinical knowledge, we know that this medicine is, we can give this medicine for the non-healing abscesses, non-healing ulcers, wounds, then sinuses, fistulas. And here I have taken the rubric from the Clark repertory, clinical from the sinuses. So if we club all this rubric, ambition increased, competitive, mildness, bad desire to remain, occupation ameliorate, anxiety children in school children about their lesson, objective reasonable, and sinuses. The clear-cut medicine which came out is the silicea. And we know the silicea from the materia medica knowledge, we know it is indicated for the sinuses. So I gave silicea 200. After 1 or 2 months, again there was some little discharge from the pus, from the sinus. That time I repeated 1 m, and after means giving the 1 m, that was the result which we saw on the 4th picture. The sinus completely healed. Now it is about 6 months. Patient went to the native place. He is studying there, and regularly, every monthly or 1.5 month, he sends me the follow and he sends me the picture. And so far, there is no recurrence of the sinus. Now we go to the case 3. This was the case of multiple cons. This 21-year-old male patient was brought by his father for the multiple con in the right grade 2 since 6 months. So during the case taking, his father is also a doctor and owns a hospital. So he knows that if the con is cut, if we cut the con, it may recur. It may recur with increased number of size, and there is no particular medicine in allopathy science. So he he decided better to go with the homeopathy. So when he brought to me during the case taking, patient told, is there any major issue, doctor? Here I saw his tone was very fearful, and throughout the case taking, he was very much afraid of this disease and what is going on in the disease. So he asked me, is there any major issue, doctor? Will I get better with the medicines, or some operation has to be done? You will not cut it with the blade. Will it pain me? I am getting tension by thinking all these things. So far, I have never been to any hospital, and this is not going. Whole day, I think about this only. Then further he told, what is this sickness? If you do not pay any attention, will it become worse? I never applied any blade on it, or never tried to cut the corn. So he never applied the blade. He never tried to cut any corn. I was looking for its treatment on the YouTube. He started searching on the YouTube what treatment can be taken for the corn. There I saw they cut the things, how they operate on it. I got scared with all these things. When he saw all these procedures, the blood is coming out and how the things are going on, he got very much scared about it. My confidence went down after seeing all these things. But I want to know what is the reason of this corn, how it comes out. I do not want to take the risk of cutting it. Otherwise, it will take a very long time for the wound to heal. Now I have decided to do medicines for it. I have completed my 12th science and now I am in 2nd year of ITI. He was also working with one private company. I will do some more degree after ITI, then I can get some higher post instead of getting some simple labor job. So here he thought that after doing the ITI, again he will go for the study so that he can get the job with a good salary. Means go for the higher job instead of getting ordinary a labor kind of job. Or I will go for some course for the merchant navy. Once I have decided to do something, I will do that. And like that only he had come for the treatment of the corn. Then I asked him, do you have a habit of going into details of everything? Here I thought of some medicine, 2-3 medicines were going on in my mind. So I asked this particular question to confirm the medicine, to confirm that rubric. Do you have the habit of going into details of everything? Here he told yes. I always see how does the things happen. Why does it happen? Then I asked him, why do you do that? So he just for the curiosity purpose or to know more detail about it. Here he answered that I want to get the knowledge about it. So whenever he used to see something on the YouTube or something somewhere in the Google, he wanted to know the little detail of that particular thing. So to get the knowledge about that particular thing. Then I asked him, how many days medicine shall I give? Whether shall I give the medicine for 1 week or I give the medicine more? Because he was coming from little bit far away place. So here he replied, just now you give me for 1 week medicine. I will see the response and then I can take for the more days. So he told me, you give me, okay, you give me 1 week medicine, then later on we'll see. So it was in his mind that if the response is favorable, then I can come again and I can take the more medicine. So this was the pictures. I could not number this picture. It was from right upper was the first picture, then left upper is the follow-up, left lower is still follow-up, and the last picture is the right lower down is the last picture. Here we could not see any trace of any cone. And it is since more than 2 years, the cone has not means return, not come back again. So in this case, throughout the interview, throughout the case taking, he had a very fearful tone. Means I could see the fear on the expression on his face. And he asked me, is there any major issue, doctor? Very fearful tone. So I took the rubric elements from fear. There I saw how they cut the things. Means when he was looking on the YouTube, he's telling, I saw how they cut the things, how they operate on it. I got scared with all these things. He was very much scared about this. Here, I took this rubric, horrible things and sad stories affect her profoundly. When he see any horrible things, it gets that impression gets in his mind and he's scared of it. Then he said, but I want to know what is the reason of this fall, how it comes out. And another thing he told when I asked him about his curiosity to get the things, means to see on the YouTube and other things to see on the YouTube, whether only for the curiosity purpose or to know more about it. Here he told that I want to get the knowledge about it. So here I considered the rubric light desire for. Then when he says, you will not cut it with the blade, will it pain me? Here it was a clear-cut rubric that he was afraid of the pain. So that's why he was asking. He did not want to cut the cone with the blade. So here I took the rubric mind, fear, pain of the pain, fear of the pain. Then last he asked me, I will do some more degree after ITI so that I can get higher post instead of getting a simple labor job. So here we can consider the rubric ambition increased. Then at the last, means this was the end of during the end of the interview, I asked him about the medicine. How many days medicine shall I give? Shall I give for the 1 week or shall I give more? So here he answered that you just now you give me only 1 week medicine and I will see the response. Then I can take for more days. So here he was talking with the physician as if he is doing a business. See, I'll see the response, and if I get the result, positive result, I see the response, then I can take more for the more days. So this was the talking business. When we club this rubric, horrible things, sad stories, light desire for, ambition increased, elements from fear of pain, and talking of the business. So the remedy which came out was the phosphorus. here phosphorus and calcarea both were very nearby. But the last rubric differentiated calcarea from the phosphorus. So here I gave the medicine phosphorus as a single dose. And we can see this result is over the period of time, initially his pain got reduced. Then slowly his all the cons started disappearing. And there was no need for me to repeat the dose. Only on the single dose he got right. So gratitude everyone for the patience clearing. If there is any question, any suggestions.
Yes, thank you. It's a wonderful presentation, and we know the treatment of local maladies and the relation with the miasms, especially psoriatic miasm. Nice presentation, and you mentioned about the transformation, not believing or not interested in giving single dose and minimum single medicine minimum dose. Then you transform successfully into a single medicine prescriber by following the Sagal's method. Time for discussion. Those who would like to participate, please raise your hand. The first case you mentioned is the hernia case, and nicely described different types of hernia, the strangulated, the obstructed one, and the reducible, everything was beautifully narrated, and the medicine worked wonderfully. And the patient survived without any danger for 2 years. Remember that he is a 93-year-old person. That is most important, and it indicates that the homeopathic medicine, the remedy will work irrespective of the age of the patient. That's often our excuse. Is old age patient may not work, but the state is work. The second case is also wonderful pre-auricular sinus. We all know the relation between the sinus and the tubercular miasm. Anyway, you beautifully manage synesthesia. The third case is also the corns, phosphorus. Nice presentation. Dr. Tanesh, please.
Yeah, thank you, Dr. Manoj. And good evening, Dr. DILIP Jani. It's really an excellent session. You really proved the science of homeopathy here. We know that there are two types of case taking as well as finding the right remedy. You just went up with the scientific prescription. We have otherwise artistic prescription. So the right precise prescription was made because your mind rubrics selection was excellent. That's the reason why nobody thought that it was a case of populace in the beginning. It was something like phosphorus or like that. But when you repertorize the same, the medicine was different. So that's really appreciable. And this is the way every homeopath doctor need to follow. Sir, you have more than some 30 years of experience. And how many times you find it very difficult in managing such cases or finding out the rubrics?
Yes, sir. I did not get the question.
Sir, usually, because you just, in the last case also, you just give only phosphorus 201 dose and you just waited for, how many months, sir?
Yeah, it took around 2 or 3 months for this thing to
Yes.
get disappeared.
Actually, most of the people believe that, oh, the patient is not responding so much, so I have to repeat like that. But you just stick on with the medicine and you got the result. That's what that is because of your experience. You are, what was the time you used to give in your early days when a patient come with such case?
Yeah, see, I tell you, in the earlier things, when I came to mind method, before that, if such patient comes to me, then I would have given this anti-improved 200, anti-improved 1M, and if the pain still persists, I would give hypericum, or I would give some other medicine like ranunculus bulbosus, or whatever these medicines are mentioned in the under the heading of the con. But I don't know whether the phosphorus is mentioned in the heading of the con or not. So what this Dr. Kent says that it is the main, we have to treat the main in the disease and not the disease in the man. It is the man who is sick and not his body parts. So in all the three cases, I considered a man and I did not consider his body parts. In the first case of cocculus, I confirmed I came to the medicine cocculus. Then I saw that whether the cocculus is covering under the heading of hernia, obstructed hernia or strangulated hernia, it was covering. So I got more confidence. Even if any medicine is coming, but it is not covering the particular, but the mentals are very strong, I would still give that medicine.
Yes,
And
sir.
I gave the water dose only these 3 to 4 doses he had taken. And next day he told me that his pain is better. So from that onward, I stopped the medicine and the patient was on SL. And slowly, slowly he started getting improved. And he improved till the hernia got reducible. After that, I did not repeat any medicine.
Okay,
Only
sir.
in the second case, I need to repeat the medicine because after giving the 200, I waited for some time. His pain was better. Discharge was also less. Then after some time, again after 1 month or so, he told now some discharge is coming out. Pain is also there. That time I repeated 1M. And after repeated 1M, I waited and we can see the result. There was slowly he got better and there was no discharge of pus. Pain was also reduced and the sinus healed completely. Now it is more than 6 months.
Sir, you are a follower of a cycle method?
Yes, sir.
From the very beginning, what really prompted you to change? Whether you follow the Indian method in the beginning and then you shifted to this cycle method, or you directly started with the cycles method?
Yeah, it was very much easy for me to form the rubrics and to follow the single dose of the medicine. And when I got these amazing results with the single dose, then I got the confidence that I am suitable for this particular method. All the methods are good. There is no method that which is not good. Our aim is to reach to the similum, whether we reach by any method. But what is suitable for our mind, that we should know. How our mind is receptive to any method.
Okay. Dr. Ramparesa, sir, do you want to ask anything? Please unmute.
Thank you, Dr. Dhaneji, and congratulations, Dr.
Thank you, sir.
Jani, sir.
Thank you, sir.
Very, very thanks. Very nice presentation. And case, beautiful case. Describe the selection of remedy according to law of homeopathic science. Treat the patient, not the disease. According to rubrics, selection, medicine, first case, second case, sinus, and third case, corns. Very good selection, phosphorus. As a generally, patient corns, entim crude, thuja, etc. According to rubrics, selection constitutional remedy. Select the rubrics. Phosphorus is a good remedy. Very, very thanks, Annie sir. Bombay, place Bombay.
Yes, sir. Thank you, sir.
Kindly share mobile number. My daughter is a Bombay.
Okay, sir. Yes.
My son is income tax of commissioner, Bombay place.
Okay.
Okay.
Okay, very, very thanks.
Thank you, sir. Thank you, Dinesh, sir. Thank you,
Yeah.
Ram, sir.
Now
Thank
it's up to Dr. Harijan sir to say a few words. Please unmute, sir.
Of course. Can you hear me, doctor?
Yes.
Yes, sir.
Doctor is at school. Hello?
Yes.
Doctor has gone, I think.
No.
I'm here only.
Hello?
Doctor
Yes,
is
sir.
here. Doctor is here.
Okay, doctor, your last two cases I heard, and very nice presentation, and your prescription is very correct. But one thing I like to ask, you last case you select on rapportization, two medicines observed. One is phosphorus and other is calculator. Why you not selected calculator? You selected phosphorus. Why it is so? That is the first
sir.
question. That is the first
Yeah.
question. Second question is that in your prescription, do you have, you will take the thermal reaction or not? Then third question is that when administering a medicine, some exacerbation comes out, how will you manage it? This is the three questions. Please tell me
Yes, sir.
your opinion.
Yes, sir. The first question is why calcarea? I mean, why not calcarea and why phosphorus? See, what I believe is that we should not go to differentiate medicine or to come to any conclusion from our mindset. Even if you know calcarea very well, even if you know phosphorus very well, or in that sense, any other medicines which are coming very close, we should go in the case, we should see the presentation of the patient, and from that only we should arrive at the medicine. So here I was also in a state of confusion whether I should give phosphorus or calcarea, That was going on in my mind. For some rubric, I asked the question, like the light desire for, I asked the question whether he sees this everything just for the purpose of curiosity or purpose of knowledge. So he told me it is I see that for the knowledge, like that. So light desire for confirm. And if we consider the light desire, these two medicines were coming very nearby. But when the patient at the close of the interview, when I asked the patient, how many days medicine shall I give, whether it is a 1 week or whether it shall I give more? So here he told me clear cut that you give me 1 week medicine only, then will I see the response, and then I will take for the more days. So he was talking as if he is doing a business with the physician. So there was a rubric is a talking business about, which is not covered by calcarea and which is covered by phosphorus. So here I went with the phosphorus. So I derived phosphorus only from the case taking and did not apply anything from my mind. About the second question, sir, thermal reaction. Whenever I come to any medicine, whichever medicine it may be, if thermal reaction, even if if there is a strong thermal reaction, suppose I have selected a sulfur and the patient is hot, then it adds to my this diagnosis of the medicine that sulfur is confirmed here. But even if that medicine does not, that patient is not hot and is a chilly patient, still I would give sulfur from the mind method, and it works. Because if you see all medicines, it may be higher in the some degree in the hot, little bit less in the chilly. So it covers the chilly part also. It is not that hot remedies are only hot and the chilly remedies are only chilly. If it is a hot medicine and I have selected the hot medicine, that confirms the diagnosis. But it is not so that if my medicine is not right according to the thermal, not prominently covering the thermal reaction, that I would not give the medicine, still I would give. And I have seen that it works. Or I use that thermal reaction for the differentiation. And the last part I did not understand. What if there is any exacerbation, what will you do? That
See, while you are administering this medicine, suppose you have given phosphorus, and
yes,
some exacerbation or any symptoms comes out. Other than this, how will you manage?
means there is aggravation of the symptoms.
No. while you are treating a patient, see, suppose phosphorus you have given, and
Yes.
and day 1 week after the patient is some affecting some see, suppose a headache is coming.
Yes.
A headache is coming. Then how will you manage it?
Yeah. This if there is any exacerbation, if the patient has come from the headache, and if after giving the medicine headache becomes more, that way you are asking?
Okay, okay.
Yeah. So I have observed this, some patient has come for the rheumatoid arthritis or the joint pains. After giving the medicine, his joint pain gets increased or it becomes worse. Here, what will I do? I will see the general aspect of the patient. I will ask about the appetite. I will ask about the bowel. I will ask about the sleep. And I will ask about, see the mental condition. If the mental condition or the generality of the patient is fine, then I would hold that patient for some time. And I would not do any antidote, or I not ask the patient to smell camphor or to take coffee or anything. I will not do that. If that generalities are worst, that means either the potency is more or the medicine may be wrong. So here I will think of antidoting by asking the patient to take some coffee or taking some strong inhalation of camphor or anything like that. Otherwise, I would not go for any antidoting the medicine. If the medicine is right, generalities are better. That means the medicine is okay.
Any diet management do you give for this your treatment? Suppose we are on chronic patients, diet management. How
Yes.
is your diet management?
Diet medicine specifically for the surgical case, like in the case of hernia, I told you take the, I know that it was a partially obstructed hernia. So I told the patient to take only the liquid diet or at the most semi-solid diet and not any means hard diet like of the oily things, then with the butter or ghee, only the liquid diet. And in other cases, these two cases of the sinus or this multiple cons, I did not advise anything regarding the diet.
Okay. See, what about the LM potency? Have you administered any patient the LM potencies and how is the result?
LM potency, I have not yet tried much, sir, frankly. So I don't have any much experience about it. I
Okay.
have given it to some patients, especially in chronic cases, arthritis or something, but don't know much about the result. So I cannot comment on that.
Okay, sir. Thank you very much for such a beautiful question and answer session also.
Thank you.
And I'm inviting Dr. Hariharan sir to say vote of thanks to the session. Please say vote of thanks.
Of course, you are a great physician. Thank you very much.
Thank you, sir. Thank you.
See, you blessed our forum with your presentation by appearing in our forum, and you gave a wonderful case taking and wonderful result also. Okay, thank you very much,
Thank you,
doctor.
sir.
Please come to our forum in some after days. Okay, thank you very
Yes.
much.
Yeah.
Good
Thank you
night.
very much, sir. Thank you.
Thank you, Dr. Hariharan, Dr. DILIP Jani, and those who attend the session. And definitely, Dr. DILIP Jani is an expert in the field of homeopathy and will come to our Zoom as doctor's convenience later. And tomorrow, we will have a session from Dr. Prakash Rao. And so we'll be discussing about homeopathic aggravation and genus epidemics part 3. With that, we come to the end of the day, 1,687. Thank you all. Good night.